Okay. Good afternoon, and welcome to today's webinar. This is part two of the Fueling Recovery series, How Medical Nutrition Supports Brain Injury Care. My name is Katie Law, and I am a Public Education Coordinator at the Brain Injury Alliance of New Jersey. BIANJ is a nonprofit organization with a mission to provide education, awareness, prevention strategies, advocacy, and support for individuals who have been affected by brain injury. I would like to announce that we will be hosting a webinar in May addressing dizziness after brain injury, and it will take place on May 9th from 12 to 1. We also have a webinar on June 9th from 12 to 1 as well, addressing memory supports for life after brain injury. To register for our upcoming webinars, you can scan the QR code or you can visit our website at bianj.org. Before we continue, I'm excited to share that BIANJ is hosting our second annual family camp this summer, taking place June 25th through the 28th at Happiness is Camping in Hardwick Township, New Jersey. Our family camp is an overnight experience designed for families impacted by brain injury. If you are interested in joining us, you can scan the QR code on the screen. I will also put a link in the chat so you can access it easily. Now, just a few housekeeping items before we begin the presentation. All attendees' microphones have been muted. If you have any questions during today's webinar, please type them in the Q&A box. We will address as many questions as possible at the end of the presentation. The webinar is being recorded and will be available for viewing on the BIANJ website. At the end of the webinar, a link for a post-webinar survey will be placed in the chat. We do value your feedback. You must complete the survey in order to receive a certificate of attendance. Once you complete the survey, you will automatically receive your certificate via email. Our presenter for today's webinar is Jennifer Breidenbach. Jennifer is an assistant professor in the Department of Clinical and Preventative Nutrition Sciences at Rutgers School of Health Professions. She has been a registered dietitian nutritionist for over 30 years. Jennifer began her career in the neuro and surgical trauma intensive care units and continued working in acute care settings, maintaining her expertise as a certified nutrition support clinician. Throughout her career, she has provided medical nutrition therapy to individuals with a wide range of needs, including chronic disease management, malnutrition, and acute or long-term nutrition support. With more than 20 years of experience teaching and mentoring students in clinical nutrition and other health professions, Jennifer currently teaches advanced clinical and medical nutrition therapy to graduate nutrition students. She is passionate about interprofessional education and representing the nutrition profession in collaborative healthcare practice. I am pleased to welcome Jennifer.
Thank you, Katie. I'll go ahead and share my screen when you're ready. Okay. Okay, I think you can see my screen, right? Okay, awesome. All right. Hello, everybody. Thank you so much for having me today. Hopefully you all had an opportunity to listen or attend our first webinar a couple weeks ago, which I collaborated with my colleague Kelly Pena, our speech language pathologist. And so today we decided that nutrition is just a big enough topic that we really need to kind of focus it on one webinar. So today I'm going to do my best to outline what medical nutrition therapy is and how it can support brain injury care. So I am from Rutgers University School of Health Professions. My email is here. So please feel free to, if we don't have a chance to connect by Q&A later, feel free to send me an email as well. So I have no disclosures, but I am a employee of Rutgers University. These are our learning objectives. Today we are going to, this is in the way. Okay, we're going to define medical nutrition therapy and how it can provide a framework for adequate nutrition health and for those especially with brain injury. We're going to identify some common challenges and nutrition problems that impact the adequacy of oral intake in individuals with brain injury. We're also going to discuss some interventions in selected brain injury conditions that could improve nutrition health, and also discussing the benefits of team collaboration for managing brain injury and nutrition. So, medical nutrition therapy, or MNT, is what I'm going to refer to it as throughout today, is an evidence-based application of the nutrition care process. And so the nutrition care process includes about 4 steps. We do nutrition assessment of the individual, or reassessment. We might see them more than once. We identify a priority problem, or a nutrition diagnosis. We then just determine interventions that will help that individual, and then monitor and evaluate those interventions, and then we keep reassessing from there on. Typically, the application of MNT, and when we're using evidence-based practice and guidelines, we see a delay or management of disease and or conditions that the individual might have. So whether it's brain injury or chronic disease like cardiovascular disease or diabetes, we'll use the same process in each patient. So the registered dietitian is your nutrition expert. We are here to partner with you. We are going to we can provide that MNT, and that's what sets us apart from someone who may just call themselves a nutritionist. There is no guideline, really. Anyone can call themselves a nutritionist, but not all nutritionists can call themselves a registered dietitian. So you'll see that the credential RDN, which means registered dietitian nutritionist, because we may have a lot of different roles, but we may be what we consider ourselves a nutritionist, where we might be working one-on-one in a community space, or a dietitian typically is the term that you might see us in a clinical setting, like an acute care setting. So we can wear a few different hats with our profession, but we are your nutrition experts to partner with you. We are going to complete assessment of an individual and we were going to take into account a lot of different things. We're going to look at medical, social, environmental factors, food and nutrition, their biochemistry, what lab work might be influencing their nutrition health. We also will evaluate comorbidities, whether that patient has high blood pressure, diabetes, cardiovascular disease, obesity. All of that kind of layers on to nutrition therapy, and then we have to kind of take all that into account. We're also going to always, especially the brain injured patient, we're going to evaluate their risk for malnutrition. Dysphagia is highly prevalent, and obviously can impact their ability to adequately consume an oral diet, may require nutrition support like enteral or parenteral therapy, and also on top of that, they may have cognitive deficit, which can lead to inadequate oral intake or malnutrition. We also evaluate micronutrients, macronutrients like our carbohydrates, protein, fats. We look at their fluid intake. We look at adequacy of nutrient delivery. So if they are eating by mouth, are they eating adequately? And if they are getting nutrition support, like a tube feeding, is that adequate too? And we'll evaluate all the patient's micro and macronutrients needs. We're going to then, that priority diagnosis or problem is really what's going to drive our interventions. And it might often, almost always with brain injury, require a collaboration with other health professionals. As obviously 2 weeks ago, you can see just the collaboration from speech language pathology and nutrition is pretty tight when it comes to brain injury care, just because of the concept of dysphagia. But we also partner with a lot of other professionals. We'll talk a little bit more about that in a little bit. The interventions we'll create are going to address our primary priority problems. So a patient may have more, a client may have more than one problem, but if the most important problem is preventing them from eating, we may drop some of the other issues that might be present. So for example, if someone does have a brain injury, but also has high blood pressure, cardiovascular disease, obesity, but they're not eating, that adequacy is going to take priority. And we may not land on, evaluating their diet for low cholesterol or sodium intake at that point. We're going to shelve that and make sure that patient is adequately eating safely. Then we're going to monitor, evaluate the effectiveness of our interventions. We're going to ensure that they're meeting their goals and adequately supporting their requirements. So this is kind of a big snapshot of what we're going to talk about, but I just wanted to give you just that distinction between a nutritionist and RD. The RDN it performs this level of medical nutrition therapy. We look at all of these individual pieces and follow that patient as long as we possibly can. So today's lecture or today's webinar, I really decided to just kind of sort of focus on these specific brain injury conditions. So stroke and dysphagia, traumatic brain injury from anywhere from like a mild concussion to a more severe, as well as someone with even a degree of dementia or cognitive decline. I felt like what I would like to talk to you about, really, I'm using the lenses of these three conditions and might refer to one or the other as I move through the discussion. So I just wanted to kind of give you that background. So as I mentioned with assessment of a patient is like a puzzle. If you like start a puzzle, you spill all the pieces out on the table and it's like, oh, it's overwhelming. You've got all these individual pieces that fit together, and then there's some that you're just not really sure where it belongs. But each piece influences really that whole picture. And we can take down we can break it down into even health professions of how each of us really complete that whole picture. But with nutrition, there is a whole set of puzzle pieces. There's a lot of things that influence food intake. So whether that's your culture, your food choices, your ability to chew, your swallowing, your ability to understand or cognitively manage a diet, those are all things that can impact the adequacy of your intake. And then as I mentioned before, as an RD, more puzzle pieces add on to the assessment, like what medications you're on, what's your nutrition focused physical assessment. So how is your muscle stores, your fat stores, how's your functional ability to chew and bite and swallow? How is your some of your sensory abilities to chew, bite, and swallow? And then also, like, how is your intake impacting your weight? Have you seen weight gain, weight loss, or even changes in edema, like you have fluid retention? All of these things are factors that we might bring into the picture when we're doing our assessment. The other thing is, really, we have individuals with brain injury that may not even go into the hospital. So we have to keep that in mind too. The advantage, if you want to call it an advantage, of somebody who is in a hospital setting, we have many health professions that can put eyes on that patient in that period of time and set you up with maybe some monitoring and follow-up. But we also have, you might have individuals with brain injury that might not have that acute care stay. So this is also meant to, give you some enlightenment on we are here for you, and you can still find the referrals you need that can help you manage your brain injury. So this is a really a little bit more of an abstract picture, and I'm not going to quiz you on it or test you on it. I do give it to my students, but I'll spare you that. This is I really enjoy sometimes looking at like theoretical models. And this is this picture of these circles. This is actually a model that describes the social ecological model of population health. And it just shows how there are many, many different factors that influence health. But in this particular image, it's really specifically looking at nutrition health outcomes, because we can't just say eat better or eat more fruits and vegetables, or make sure that you use a blender when you're consuming your diet, and make sure it's a thickness of this. We need to think about all the influencers of what goes into a patient's intake or food intake. We have a lot of individual factors: your age, your demographics, of gender, socioeconomic status, where you live, your genetics. You also have environmental settings where, again, where you live, your schools, what kind of recreational facilities do you have walkable spaces for exercise or functional or physical therapy? Even things like sectors of influence, like what kinds of advocacy groups are there to help you if you need it? What are you influenced by marketing marketing, media, social media. How does the industry influence your intake? And then obviously things like culture, religion, priorities, your lifestyle, body image, many of these things will influence a patient or individual's intake of diet and food. But the utilization part is on the right here. That's where when we come in and we are going to take into all the account of what factors into the food intake. But there are so many things that impact your utilization of nutrients. If you're a smoker and medications, diseases, if you have any particular underlying disease or GI disease, these are things that are going to change how you maybe metabolize or digest your food. So you can see that nutrient intake, nutrient utilization, and your requirements all come together and can impact your nutrition status. So how your lab work and how your blood sugar and how your cholesterol is responding to all of this intake and these influencers, and then that can influence health outcomes. So that's a big model, but I really like how it can look at it in a larger lens, kind of up more of like bird's eye view. We are going to really focus in on the challenges and the nutrition diagnoses that really influence nutrient utilization. So that's where we will, like as I mentioned, that's kind of where we target and how to improve. But we may need to look at those factors that influence intake too, which is why we have community-based programming and we're advocating for equity and all of that's needed for socioeconomic changes that we see in different populations. But in this case, what we'll look for to help the immediate situation is we're going to look specifically at clients' adequacy of their intake. We look at maybe specific nutrient specific intake, so their vitamins, minerals, or protein, fat, carbohydrate intake. We'll look for chewing and swallowing disorders, malnutrition. We'll also look for changes in weight and anthropometrics and more. So there's a lot of things that we can prioritize, but sometimes we have to determine what's going to get a client or individual from point A to point B in improving their nutrition health as well as their brain health. So some common challenges that we might face with brain injury, first and foremost, is dysphagia. It's that neurological impact on swallow. I would highly recommend for you to take a look at the webinar that we talked about 2 weeks ago. Gives you a really nice, Kelly does a great job with describing the physiology of dysphagia, but also how we can manage it in the end. Cognitive processing disorder. So really working on that day-to-day practice of how do we get individual consuming a diet that's going to support their health. And we'll talk a little bit about that. We also know that traumatic brain injury in the acute stages have an elevated energy and protein requirements. So our body's metabolism sort of amps up after a brain injury, and we need to support those energy and protein needs. And it's usually during those acute stages, maybe that first 5 to 7 days. But it's really important to try and meet those energy needs. And if you have a patient who has a severe head injury or severe brain injury, they're usually in that acute stage or acute space in the hospital. So as an RD in there, we're looking at making sure they're fed adequately so that they're getting the nutrition and their protein and calories especially adequately, because that brain needs to be fed. Enteral versus oral intake. So that kind of, sort of comes into play if you have that severe dysphagia. And then sensory changes. With brain injury, you're going to see sometimes changes in taste, smell, vision, hearing, and touch. So that can all influence how your patient or your client is eating. If it could change their appetite, it can decrease their drive or motivation to eat altogether. So these are we're going to talk about some common interventions, but I do break it down a little bit with some nutrient specific recommendations. So this snapshot is kind of like a little sneak peek of what I'm going to talk about, but you can see obviously food is a big part of our interventions, right? It's we want to get adequate nutrition into our patient, our clients, and fresh fruit, berries especially are going to hear the value of that, salmon and omega-3 fatty acids, fresh fruits and vegetables, as well as modification of textures that will be required, or even enteral nutrition alone through a feeding tube for a patient who can't adequately consume an oral diet. These are all just a quick snapshot of what we're going to talk about. So I want to first talk about dysphagia, just because, and again, I'll highly recommend for you to, again, just to go check out that other webinar. But we actually did show this slide because I felt like it's a good one, because whether you're, the patient with, whether you are the one with a brain injury or you're a caregiver with an individual for someone who has a brain injury, these are really good signs and symptoms and predictors of dysphagia. And dysphagia doesn't have to show up right in the beginning of the brain injury. It can develop over time depending on the situation that you're dealing with. So if you notice that your loved one or yourself, you are starting to pocket food. So you're noticing you can't clear the spaces between the cheek and the gums, and there's poor tongue and head control. Now that can be something that is probably a little bit more obvious, especially with a more severe injury. But other things can be more subtle. So like slow oral transit, like it's taking a long time for you to get food from the front of your mouth to the back of the mouth and initiate that swallow. If there seems to be some regular coughing or choking after you're either drinking or eating, and drooling especially, that would also give you some indicator that there might be some musculature, or there's a nerve, like your cranial nerve issue, damage that could be prevalent or obvious. General facial weakness, so even drooping on one side of the mouth or the other. Food gets stuck in your throat. So if you, like right now, my mouth is a little dry, but you find yourself when you're swallowing that you need a drink, like you need something to help that food go down. The salivary production is connected to your cranial nerves. So if there is any damage to that, you can find dryness of mouth and even dryness in the upper parts of the GI tract. So that's really a good predictor. Gargly voice, you just can't seem to clear your throat, or you're just having a constant gargle. That is also maybe it's disorders of the swallow. Excessive eating time. Now that can be something that is typically fine and normal, and if that's a routine, but you're able to finish the meal, it's okay to have long amounts of time to consume your diet. But if you notice it's taking longer and longer for your loved one or for yourself to finish a food because of fatigue or some kind of cognitive change, so that they're kind of losing track of their timing, that's something to also keep in mind. Mealtime resistance, where mealtime just doesn't become fun anymore and the quality of life starts to drop. And we really want to know that the speech language pathologist too, because that can also mean that there's some discomfort in the action of swallow that may be hard to describe. And so that may also lead to poor intake and eventually weight loss. And so those are some of these things all kind of go together. Regurgitation, so if you're unable to complete the swallow and it tends to kind of revisit itself back up in the back of the throat. And then also dehydration. So a lot of times your thinner liquids are going to be harder to swallow. So your loved one or yourself, you may just naturally avoid clear fluids because of just that you notice if I drink water or if I drink juice, it makes me cough all the time. So I'm just not going to drink. And that can be like, again, a lot of these kind of work with each other, can cause dehydration. increased efforts with even taking pills. So that can be a good sign as well, just to know that you're having that trouble with the completing the swallow. Stress with eating, just same with that mealtime resistance and decreased pleasure with eating. All of these can kind of go hand in hand. And we would want to know that, because usually what that leads to is some kind of poor intake, and then even things like weight change, weight loss. But we also shared this slide as well a couple weeks ago, and I bring it back up again because aspiration pneumonia is what we're trying to prevent. It's that aspiration of food or beverage into the lung, which can cause infection, and that is what we're trying to prevent when we are identifying a presence of dysphagia. And dysphagia and malnutrition can tends to be in this little like cycle relationship. We want to prevent malnutrition because malnutrition really can lead to exacerbating other problems. So we lose function of our immune system. It can lead to things like muscle breakdown, poor wound healing. If there is already some skin breakdown, we want to avoid further skin breakdown. The patients with poor immunity are going to be higher risk for infections, and that's going to increase things like their energy requirements, protein requirements, and then also exacerbate things like skin or wound healing. Poor muscle, though, muscle breakdown, muscle loss is going to decrease that individual's functional status, makes them wanting to stay in bed more or sitting more, less functional in terms of moving around, walking around. And also that's going to ultimately our swallow is dependent on lots of muscle systems. So with atrophy of muscle, it's not just in your bicep and your tricep, it's also in your ability to swallow, the muscles of your swallow. So again, there's kind of this vicious cycle that can happen when you start to see patients with malnutrition and not adequately being consuming enough calories and protein and nutrients to support their requirements. So some of you might already be familiar. If you do have dysphagia, you're going to be evaluated with the speech language pathologist as well as teamwork with us. And you might be required to put on a consistency diet that will help you manipulate your food and beverage to the back of your throat and initiate a swallow that's safe. So the thinner the liquid, is going to be the harder, the harder liquid consistency that's going to be managing. So you start with thin and you go to slightly thick, mildly thick, and then moderately thick. And then eventually your food may also be pureed, minced moist, soft bite size, and ready to chew. So in this particular, what we look at, this is this classic IDSI is what we call it, the International Dysphagia Diet Standardization Initiative. But we actually use these numbers to help us describe what our individual client might require with their dysphagia. So if they're eating, swallowing fine, then they're going to be eating a regular diet and drinking thin liquids till their heart's content. But if they're starting to have some changes and problems with their chewing, mastication, and also their swallow ability, then we might be going down the scale of doing soft bite size or minced moist or pureed. And then we will then also modify their liquids to a thickness that can also make sure that they are safe. So this is a language that is utilized for the dietitian, the speech language pathologist, but we also will educate and provide this information to caregivers as well, whenever a patient might need that. And again, this is probably the most in more severe brain injuries, it's highly prevalent. So this is why we want to lead with this knowledge. So when we have a patient, though, who may not necessarily have a full-on dysphagia, we do want to make sure that adequate nutrition is being delivered and that they're not having any issues with oral intake. But number one is always evaluate their swallow. If you see a patient who is not eating well or is having poor ability to chew, swallow, and food, just not adequately fueling, they're not adequately eating enough nutrition or consuming enough nutrition, you want to look and screen for maybe a dysphagia disorder. Maybe there's something there that, like we talked about, that could be impacting their ability to swallow. And it might be something that's not super obvious. But if not, if they seem to be swallowing fine, then really the approach for our folks with that aren't eating adequately is really looking for density. So calorie and protein dense foods and snacks. So I know there's a little icon of a watermelon. That's probably not the greatest example of a calorically dense snack, but apples with peanut butter would be a great example of a calorically dense fruit with maybe some additional protein on there. So like some like maybe cottage cheese and some pineapple, or some kind of cheese and fruit combination, grapes and cheese. But the idea is to provide caloric density, especially protein density, and trying to avoid snacks like crackers, Cheez-Its, chips that are kind of just they have a nutritional value to them in terms of like they've got calories in them. But what we're really looking for is to make every bite count. I have that sort of on the bottom there. So if your appetite is poor, we're going to utilize snack time and try to get things, whether it's through a liquid supplement, maybe they're making their own, we can make shakes for them, puddings or yogurt with additional ingredients in there. At their breakfast, you're giving oatmeal, but in that oatmeal, you're using whole milk to kind of cream it up. You're adding things like chia seeds or a protein powder to kind of give it a boost in terms of calorie and protein. So those are some approaches that we might do. So beverages as well. So we're trying to get, sometimes it's easier if the patient's calorie requirements are high and they just have no appetite to meet them. We're trying to, in between meals, maybe give them a 4 or 8 ounce type of drink that could help them, and you can create that with your own blender, or there are many different supplements on the market. But small frequent meals is really what we're trying to encourage, so that a patient is, or a client is really kind of on this regular clip of eating like every 2 to 3 hours. And it's not snacking on chips, but adding something with substance in there so that they're getting almost like small frequent meals. Sometimes we tell like I've told clients before, is like, make yourself a sandwich. Say it's a turkey with on a nice piece of bread, but and adding some additional items in there, some additional spreads, or even greens, but then have that half, and then like 3 hours later have the other half. Then they're not so full and they're done for the day. So you typically are trying to encourage like a half a sandwich and some kind of beverage like milk, or some kind of anything that they could tolerate, but avoiding water, like trying to get something with caloric value in it. And again, every bite counts. Sometimes we're also, with someone who's not eating adequately, we're going to recommend at the baseline just a multivitamin, just to kind of capture some of those baseline vitamin mineral requirements. But we're going to talk a little bit more about some other supplements that are possible. And so I wanted these key nutrients to assist with brain injury. So it's been actually, there's so much research now. We've been learning so much about different specific nutrients that really support brain health. And so I could talk about them all, but I think I'd lose you about, a few slides through. So I grabbed some, and we're going to talk about those. But I'm mentioning a few more, because what I would highly recommend is to make sure that any kind of supplement or nutrient that you are consuming does have some evidence to support it. And that's where we can help you discern that. But I'm going to talk about a few other components of decision making too. So let me just go ahead. We'll get started with omega-3 fatty acids. Omega-3 fatty acids, or sometimes people just call it fish oil. And we use fish oil because that is the most prevalent form of omega-3 fatty acids, which are, I won't tell you the full long, but DHA and EPA are two components of omega-3s, and they're very commonly found in fish oil supplements, or in fish sources. So we do utilize omega-3 supplementation a lot. It's used for really to avoid it's an anti-inflammatory. It's got the way that we oxidize, the way that we break down omega-3 fatty acids is less inflammatory than, say, an omega-6. An omega-6 would be like your regular like vegetable oil, or say canola oil, like your omega-6 fatty acids. So we do like the anti-inflammatory aspects of omega-3. In fact, we can see it used in conditions like cardiovascular disease and other disease components too. But we do have the data supporting that omega-3s do support brain structure by decreasing that neuroinflammation. And it also can help support your cardiovascular response in cognitive function in those early stages when you have that, like as I mentioned, the early stages of severe brain injury, your energy and protein requirement, your energy needs kind of jack up a little bit. And that omega-3 support can help that cardiovascular response to help you get the blood pumped to the areas that you need to support the circulation as well as energy production. So the aim for is really fatty fish or some kind of things like salmon, mackerel, 2 to 3 times a week. And if you can't, just go with 1 to 2 times a week, whatever you can consume with as a fresh source or a food source is always very good. You can also go for non-fish sources of omega-3. The picture here shows like some pumpkin seeds, some walnuts. You have flax seed, which is another grain that can be utilized and mixed into things like with yogurt, salads, or even you blend it in with your rice or like as an addition to like even a pasta. So these are things that you can use that are good sources of EPA and DHA. That's your key, is to get those particular components of omega-3. And your target is 2 to 3 grams a day. And that would be, so if, for example, I have a supplement, omega-3 supplement I got from Costco, and it's 1,400 milligrams of fish oil. But when you look on the label, it'll show that there's about 1,000 milligrams, about a gram of that EPA DHA in one serving. So a lot of fish oil supplements might range in terms of total grams, but you want to look for the total EPA DHA content of that supplement. And if you're in the acute stage of a brain injury, so say if you have a concussion, mild or even moderate, you can safely consume, say, about 2 grams of that EPA DHA. So I would probably double that fish oil for just, I wouldn't say forever, but you would utilize that, say, for the first 7 to 10 days. And then kind of bring that into your daily routine, and you could kind of back off the dosing there. But acute phase, this is something that needs really under medical guidance. And all of this, and I want to say, should be discussed with your physician as well. Because if you are on some medications, do have an interaction with omega-3 fatty acids. So we want to make sure that all of this discussion is included with your physician. But acute phase loading, so someone with a very severe TBI, they may require higher doses, but that's something that should be done with your physician. The next nutrient that I'd like to discuss is creatine. Creatine monohydrate this is a supplement that our athletes have been utilizing. We have a system of energy in our bodies, the creatine phosphate system, when that's typically used for our sprinters and our fast twitch, athletes. But that creatine phosphate system is a way that can be depleted very quickly. And if you support it with creatine supplementation, it provides a little bit of an extension of energy provision during an activity. But what they're finding is that supporting that creatine system also supports cognitive health and brain health. Lots of very interesting research coming out with using creatine supplementation with psychiatric disorder symptoms as well as cognitive health. When you're using creatine, you typically are doing a loading dose in the beginning. For about 5 days, you're giving yourself more like 20 grams a day, but it's broken up into like 4 times a day. But then you would back down to say 3 to 5 grams a day. So that some people argue you don't need the loading dose. You can just go right into like 3 or so grams a day. But that's one of the ways that we provide ourselves. You want to use the creatine monohydrate form as well. If you are taking large doses, sometimes that can cause some distress. and you can see some weight gain in the retention. I've given you a really good like a nice little a website here that gives you some good evidence to describe and explain a little bit about creatine. I'm adding these images here to remind you that anytime that you are using a supplement, whether it's omega-3 or creatine or any others, you're going to look at the bottle and you're looking for something like this. USP is probably a very common one. A lot of Costco supplements you'll see are have USP labels. What this means is that there is a third party that has looked at that product and has confirmed that what is in that particular jar is what is on the label. Because supplements are not considered a food, or they're not a drug, like they're kind of in the middle there. They don't have the scrutiny that you might find with drug manufacturers, where they are confirming and validating that this product is not only safe, but it is actually what is on the packaging. So this is why you can find a lot of contamination in some supplements. People can earn a lot of money by manufacturing supplements without they can do that without confirming the adequacy or the legitimacy of that product. So please be careful and use these markers on the labels to make sure that, and these are just a few of them, there's a few other, but these are probably the most common. Consumer Labs, USP, and NSF are the three that I see the most. Okay, so now we're looking into some food components. We see that anthocyanins is really the phytonutrient that we see in blueberries. So phytonutrients themselves are a part of an anti-inflammatory process that we have from all of our beautiful fruits and vegetables that are lots of color. It's why we say eat the rainbow, right? Because a lot of color in all of our foods that are red, green, blue, orange, yellow, they all have these phytonutrients that are considered part of an antioxidant system, which they reduce oxidative stress. But the phytonutrient anthocyanin has been studied to look at neuroinflammation. So it tends to you see decreases in neuroinflammation, and it can actually, there's been some studies on its improvement in cognitive function and memory performance. So the aim really is to having a good diet. And I mean, there has been some supplement there, but you can easily meet the requirements for anthocyanins by incorporating blueberries, blackberries, elderberries, chokeberries, a couple of other common berries into your diet. So fresh berries, a half a cup of blueberries in a smoothie can give you about 100 to 300 milligrams of anthocyanins, and your aim is to get about 250 to 400 milligrams per day. So whole foods are best. Trying to get other sources of polyphenols while you're at it is always great. So not only the blueberries, you can add leafy greens, you can add things like cocoa nibs, or nuts and seeds, extra virgin olive oil. These are all things that will also have other phytonutrients that can help as well. So this is in table form, the article that I provided you the reference for it, but these are some others I just wanted to show you. I talked a little bit about omega-3, creatine, and anthocyanins, but other nutrients that have also been studied, branched chain amino acids, leucine, isoleucine, and valine. These are our amino acids that are mostly you get from protein foods. Riboflavin, choline, magnesium, these are all different types of B vitamins and minerals that we will use. But you can see in the food sources that protein is a very big part of getting some of these nutrients. So if you have someone who is a plant or vegetarian or a vegan, then it might be difficult to get some of these nutrients that are in. I'm not saying they can't, it just means that they will need to get creative or require that vitamin supplementation. But magnesium is something I wanted to just highlight because there's been some research with magnesium that because we have seen a lot of magnesium deficiency, so that in many people, a lot of it, if you look at the sources of magnesium, nuts, seeds, and spinach, right? So those that are not incorporating some of this diet food into your diet, you might see some really key deficiencies. So having good magnesium into your diet as well. These are some other nutrients. I'm not going to talk too much more about that. The only thing I want to highlight is vitamin D has a role in neurotransmitter formation, and we want to make sure that anyone with a brain injury has adequate stores, and if not, will be repleted. So how do we pull some of this into a dietary pattern so that we can, rather than just say eat blueberries, have omega-3s, eat fish? These are some of the dietary patterns that we're going to maybe educate our clients on. So whole foods approach always. So go for the food first versus the supplement if you can. And also instead of the processed food. And we want if you can't get fresh blueberries, go frozen if you can. But blueberry flavored oatmeal is not going to give you the same impact as fresh blueberries in your oatmeal, if that makes sense. So those are the things we're going to always kind of promote. Mediterranean diet is a great pattern as well. Very lots of monounsaturated fatty acids, olive oils from fish, antioxidants from fruits, vegetables. We have the DASH diet. The MIND diet is what I'm going to talk about. But I also wanted to let you know that the ketogenic diet is also, the research is building on using the ketogenic diet for improvements in cognition. But again, that one's going to be could be tricky to follow. And again, it's also about longevity. It's not one of those things, those diets that you just try, and if it doesn't work, you come off it. You would really need to get the benefit of it. You need to stay on it. So it takes some commitment, but that's something that is in research. So the MIND diet, that stands for the Mediterranean DASH diet intervention for neurodegenerative delay or MIND. So you can see that a lot of this MIND diet component is a lot of what we just talked about. Getting fruits and vegetables, berries, 2 to 5 servings per week. Whole grains is emphasis on grains that are minimally processed. We need fiber to support your gut. Seafood, again, fatty fish such as salmon, mackerel, herring, sardines. These are all great sources of omega-3. Beans and nuts and seeds are good, animal, not like plant-based foods that can be incorporated into the diet. Poultry can be utilized for a protein source, maybe 2 times per week, and then using extra virgin olive oil to not only with just like with cooking, but just even within the recipes itself. So all of these have really strong components of improvements of brain health. But let me real quick talk to you about this, the gut-brain relationship, because that's another lecture. Maybe I can come back for that. But you got to remember that the enteric nervous system, which is the gut's nervous system, we have 100 million neurons just in our gut system, the brain-gut relationship. We have bidirectional signaling. So it means that whatever's going on in our gut goes to our brain, whatever's happening in our brain can land in our gut. And what that means is that, the microbiome is the bacteria that are in our gut. They each have their own genetic makeup and system, and they are what kind of creates that pathway of communication to the brain. And when we have things like inflammation or poor diet or any insult to the diet or to the brain, we might have a disruption of that, and it can impact things like cognitive function, psychiatric disorders, things like that. How do we do that? How do we support our microbiome? We want to include fiber in our diet. So it's one of the reasons why I included, just some, and from, why I included like whole grains in the MIND diet is kind of that key to kind of bring those in. Pre and probiotics are those two components of a food that can help with supporting that microbiome, whether prebiotics being the food for our microbiome or probiotics, which are those live strains of bacteria that can actually restore things like fermented foods like kombucha, yogurt, kefir, things like that. Okay, these next few slides, are really about how we can maybe establish some goals with our patients that have some cognitive decline. And I really want to target that. And I've already talked to some of these points. I'm not going to talk through every single one. But I want to also just reiterate the importance of maintaining adequate fueling. So making sure that sufficient calories and protein are and nutrients are met with the individual because underfueling is not good for the brain. So if they're a picky eater, they're not eating adequately, it's not going to improve their cognition. So I just want to kind of reiterate that as well. Um, Anything else will really depend on the patient's individually. So if you have some severe TBI where there is a lot of confusion in the environment, then there are things that you can do to help with just the food process. So offering one food at a time, simple place settings. The plate should be a different color than the table. Adding things like condiments before the serving the patient. Finger foods throughout the day or can be helpful if your problems with functionability and they need some adaptive equipment, then we're going to partner with our occupational therapist um, as well as just looking for those signs and symptoms of dysphagia again, right? So things that are going to that might impact their ability to swallow. So providing verbal and physical cues to help your loved one know when to chew, when to swallow, and then allowing that adequate time. Try not to rush, but giving that amount of time to help them. We want to really aim for independence as much as possible, right? Anyone with a brain injury will want that for themselves. So try to build that routine. I highly recommend couple of the videos that are on the BINJ website that kind of helps you navigate some of those challenges that could be helpful when you're having cognitive issues, maybe establishing things like a routine or a calendar or color coding so that you can help know like what's for breakfast, what's for lunch, what's for dinner. Find something that works and just keep it on repeat. If you know a certain breakfast works for you and you have a routine that can help you and know how to prepare it, then keep that going because that's going to help with your memory, especially when you know you're ticking a lot of boxes with that particular meal. Maximize your food intake when your cognition is the best. So if breakfast and lunch is when you feel the strongest, then let's go with those meals to help maximize your food intake. So using those calorically dense or drinks or beverages or those snacks during those meals so that you can build up your energy that way. But also just be strategic. So in a couple of those videos, they give you some really nice ideas on how to navigate and break down the steps of your day. Like, when you have to, writing down in a calendar or even in your apps and phones, maybe building out a reminders on your smartphones on when you need to eat, when you need to drink, how to, like, when to food prep. And maybe it does require one time during the week where food preparation happens for the whole week. And then you're providing you can organize recipes and containers, color code them for what you're going to eat on Monday, Tuesday, Wednesday. And then this takes time and may take some partnership with caregivers, but these are strategies that have worked. And depending on your ability, that's something that can really help you avoid that, oh, it's lunch, I'm hungry, what do I eat? I'll just order takeout. Those are the things that can really help you meet those goals that you really want for yourself. Including the caregiver, obviously, to help your goals, having them meet your goals as well. I think good food choices are good for everyone. When we talk to our pediatric patients and clients, we're giving them information, but it's really good for the whole family, right? So having fresh fruits and vegetables, fiber, and nice fibery foods or even berries in your diet are good for everyone, not just for one person. And you can learn a new recipe together. I gave you a link for a nice smoothie that includes beverages and spinach. So like, those dark green leafy vegetables as well as some berries. So and highly encourage you to check out BINJ as they have some really good resources on just how to coordinate and organize your thoughts to help you decide, and kind of kind of overlap that with your nutrition goals, and we can work together with you on that. So finally, these are just some things that we're going to monitor and evaluate as the patient is finishing up their time with us. We're going to make sure that all of our goals are met. And finally, and what leads to that is collaboration. And I mentioned this many times throughout our conversation, but speech language, obviously, but we partner with all of these folks and more. And these all these folks can help with adequate nutrition intake as well. So we utilize all of them to help with determining risk for dysphagia or, actually feeding patients or functional status or abilities to consume a diet. So that's it for me. I'm happy to answer any questions that you might have.
Thank you so much, Jennifer. That was really informative. Yeah, we'll take a few questions. We have a few minutes. I don't see any in the chat right now, but if you want to put any questions in the chat or in the Q&A box, we will answer them.
Yeah, and I did have a couple of resources. I'm going to provide um have some updated this I'll provide this lecture PowerPoint to Katie if you're interested. But these are just some of the references that I utilize, but also recommend for you guys to check out as well.
So we do have one question here. Do you feel acai bowls are healthy?
So it's funny, I've heard that pronounced a lot of different different ways. So yeah, those can be very, as we talked about caloric density and nutrient density, they've got the potential to do all of that. And just they are absolutely but as sometimes though, depending on what you're adding, and healthy is always a tricky word to define, right? If when it comes to providing things like good source of calories, good source of nutrients, especially like the fruits, the phytonutrients, like we talked about, even some grains can give you a lot of that. Protein, though, sometimes those bowls can lack. They don't necessarily have a really good protein base unless it's like a yogurt or something like that. So you want to kind of make sure it's a little bit more of a complete meal when you're having it, rather than just a fruit smoothie that hasn't been put in a blender. That kind of how I see some of those bowls, is just like you could easily just take that, dump it in a blender and blend it up, and now you've got a really nice smoothie too. So yes, of course they're healthy. It really, with anything with a bowl, or like when you have to make choices, even a salad bar has the potential for tipping, the choice to like say, well, maybe you don't need all of the cheese and the eggs and the cream dressing, but you can add things like, cranberries and grains and another source of greens, two or three different types of greens. So you want to be careful with any time you have the ability to choose ingredients in something.
Excellent. I don't see any other questions. If you have any questions, please put them in the chat or the Q&A. We have about another minute. I think you covered everything so beautifully.
Thank you. Well, it was my pleasure. If anyone, yeah, as I said, I'm happy to answer any questions if anything comes up. I'll put my email in the chat just so that you've got it here.
Yes, we will provide her email.
There you go. That looks
That
like,
is in the, I will just get that to everybody.
oh yeah, the
That's okay.
there was one question about my email. Did I already see it, Delina? I was a step ahead of you. Well, thank you. I appreciate your kind feedback. It was easy. It's very easy for me to talk on this topic, and as I said, I could have probably gone down a few rabbit holes, but I really tried to hold myself to what we had here today.
Yeah, good. Okay, so thank you again. If you do think of questions, we have Jennifer's email as well as my email at klaw@bianj.org. Thank you again. One final reminder, the post-webinar survey link is in the chat. Please complete that, and you will receive a certificate of attendance. Thank you again for attending. We hope to
Yeah.
see you at next month's webinar addressing dizziness after traumatic brain injury. And this concludes today's webinar.
All right. Have a great day, everyone.